Bismillahirrahmanirrahim. Order to the education is the most powerful weapon which you can use to change the world. I'm Dr. Mahnoor, teacher in Community Medicine Department, AMU Lahore. Today I am going to present the critical appraisal on the topic of multimorbidity of non-communicable disease in low-income and middle-income countries, a systematic review and meta-analysis under the kind supervision of my worthy Professor Dr. Saira Afzal. For this critical appraisal, I will use the PRISMA checklist, which is the transparent reporting of systematic review and meta-analysis. So here is the PRISMA checklist. First of all, we will focus on the title, multi-morbidity of non-communicable disease in low-income and middle-income countries, a systematic review and meta-analysis. In title, according to PRISMA checklist, we see either it is a report as a systematic review. So the title clearly identifies the study as systematic review and meta-analysis. First, then we move on abstract. So in abstract, we see the objective background, in which we see objective, method, results, discussion, and others. So abstract of this systematic review provides a structured summary including background, objective, eligibility criteria, data sources, study selection process, data item extracted, synthesis methods, results, conclusion, and registration. Risk of bias, implications, limitations of evidence are not mentioned in this abstract. In introduction, we see for the objective and rationale, which is highlighted over here. So this systematic review provides us the rationale, while the objective is not clearly mentioned. As according to PRISMA checklist, objective should be explicit statement or question to review the addresses. Then we will move in methodology or methods. Here we can see the further subheadings of methods as patient and public involvement, search strategy, including exclusion criteria, definition, terms, data extraction, quality assessment, data synthesis. According to PRISMA checklist, what we see in our method is either it provides us the eligibility criteria, information sources, search strategy, selection processes, data collection processes, data items, study risk of bias, assessment, effect measurements, synthesis method, reporting bias, certainty assessment. So in this systematic review, methodology present full search strategy for all databases, including filter use, specifies detailed inclusion exclusion criteria and how studies were grouped for analysis, lists all the database searched and other resources for studies identification, specifies methods for data collection from studies clearly and defines all outcome data extracted, list other study variable extracted like participants and intervention characteristics, specifies effect measures used to synthesize present result for each outcome, explains methods to determine study eligibility for each synthesis, describes data preparation method, describes methods for tabulating, displaying, and synthesizing results and rationale for choice of meta-analysis model, provides software used. While does not, these are the things which are not mentioned in methods, which should be added in according to PRISMA checklist. Doesn't mention if all compatible results were sought for each outcome, nor describes method for exploring causes of heterogeneity and conducting sensitivity analysis, specifies method for assessing risk of bias due to missing result, nor describes a method for assessing certainty of evidence. In result section, here is the PRISMA flowchart. It is the table, three table mentioned. There is a data extraction table. There are three further data extraction table also in study. The result is concluded in form of forest plot. So in result section, according to Prisma checklist, what we see, the study selection, study characteristics, risk of bias studies, results of individual studies, results of synthesis, reporting bias, certainty of evidence. In the systematic review for each synthesis summarizes characteristics but not the risk of bias and contributing studies, presents results of all statistical synthesis conducted, including summary estimates the measures of heterogeneity, presents results of all sensitivity analysis assessing robustness of finding, presents assessment of risk of bias due to missing results for each synthesis, presents assessment of certainty of evidence for each outcome. Presents study selection results via flow diagram from record identified to study included. Lists studies excluded after full text screening with reasons. Describes characteristics of included studies in text and tables. For all outcomes, present summary statistics, effect estimates and precision for each study in structure table and forest plot. Now, in discussion, there is a heading of implication of funding. In this systematic review, there is also a heading of strengths and limitation. So, according to Prisma checklist, what we see in discussion is either it provides general interpretation of results in context of other evidence, discuss any limitation of other evidence included in review, discuss any limitation of review processes used, discuss implications of results of practice, policy, and future research. So, this systematic review, the subheading of discussion interprets results in context of prior evidence, discusses strengths and limitation of included study, discusses the limitation of review method, discuss implication for practice, policy, and researches. Here, at the end of discussion, it is the other information which is given in this systematic review. So, for other information, we see according to Prisma checklist, either registration and protocol is provided, sport is provided, competing interests is are provided or not, availability of data, code, and other materials. So, this systematic review provides registration details including registration number and link to protocol, notes, protocol amendments mentioned in method section, describes sources of sport, role of founders, declares competing interest of authors, ethical approval was taken although it wasn't needed. Now we'll move forward the strengths of this systematic review. It clearly defines research objectives and eligibility criteria, comprehensive search strategy across 5 databases without restrictions, rigorous study selection, data extraction, and quality assessment done in duplicate. Majority of study from WHO study on global aging and adult health, SAG, high qualitative standard due to standardized method and large sample size in underlying studies, provides global prevalence rate and predictors for mortality. Tabular and graphical representation of results are given, adherence to Prisma reporting guideline, inclusion of studies from multiple countries in the multiple languages, provides first meta-analysis, bias was assessed, limitations were mentioned, implications were mentioned, ensure standardized method for measurement and data collection. There are also some limitation of this systematic review. Relied on self-reported failure for data collection on multi-morbidity, potential for recall and self-declaration bias leading to under or over-reporting, language bias as it's not included studies conducted in other language than English, exclusion of studies from non-English speaking LMICs like South America, studies assessing determinants of multimorbidity didn't consider the heterogeneity and clustering of condition. Observational studies included patients with diverse characteristics and setting causing substantial heterogeneity. Predominant use of cross-sectional design limit the ability to establish causal relationship, lack of intervention studies, so only association between risk factors and non-communicable disease, multimorbidity were analyzed, exclusion of mesh terms related to metabolic diseases due to their association with major non-communicable diseases, but the search strategy aim to cover these risk factors in multi-morbidities. This is the link of our YouTube channel. Kindly like and subscribe. And thank you so much for your kind listening.